This is the Radiant device, specifically designed for treating non-melanoma skin cancer. It's a unique, flexible machine that actually allows you to treat with two modalities. It allows you to deliver superficial radiotherapy and also electronic brachytherapy. People often ask about what's the difference between superficial radiotherapy and electronic brachytherapy. They're two different treatment modalities, and because of the difference in X-ray intensity, they have different outcomes. Often superficial radiotherapy requires maybe 20 visits to the doctor's office. Electronic brachytherapy can be delivered in about 8 to 10 fractions. So it's more convenient for the patients, less visits, and the clinical outcomes are very similar. By changing the combinations of some of the things in the electronics, the treatment applicators and cones, and also the filters, we enable both techniques. So if a patient is more suitable for superficial radiotherapy, you can treat them with the Radiant. If a course of electronic brachytherapy is more appropriate for that patient, you can choose that without having to have two different devices. And this is really the first system in the new range of Xstrahl products. They're going to be a small, compact, and designed to bring in modern technology so that we can enable more treatments for more patients and make this more accessible to everyone. We designed the Radiant specifically on wheels so that you can maneuver it around the treatment room and easily bring it to the patient's bedside. The wheels are large and the brakes are easy to maneuver, so you can just simply maneuver the machine backwards and forwards. It also can collapse down to quite a small size and go into the corner of the room. If you're not using the room for radiation treatment that day, you can have it in the corner and use it for normal clinical practices. The head mounts on this unique ball joint. That means you can really move the X-ray tube around. Often with skin cancer, they're not in necessarily the most easiest place to access. It could be in the inner canthus, or somewhere else on the patient's body that you really want to be able to get in to get a nice, fluid, flat field for them to be treated with. To help you with that, we actually have a light that illuminates the end of the cone, and that way you can see that you're getting good contact with the patient's skin. Filters and cones are easy to change. You just simply switch these out and then replace it with the one that you wanted to use. And the system itself actually recognizes which one's in place. So you wouldn't be able to treat with the incorrect applicator and filter installed. The software that we deliver with the system also helps integrate with your practice. It's very simple for your operators to use. It ensures safety of your device by making sure that the right filter and applicator are selected. We've built a community of experts around our users because often doctors aren't necessarily used to using superficial radiotherapy or electronic brachytherapy. The important thing here is safety and education. At Xstrahl, we utilise the fact that we're in this unique position, having treatment systems and research systems across the world, that we have the experts available to us to support our customers. This is a cost-effective methodology of being able to treat skin cancer. It's cost-effective for the patient and for the physician. The clinical outcomes are excellent. There's a 96 to 98% chance that there'll be no reoccurrence of the cancer. It's flexible and patient-friendly. Radiant is a smart, simple, successful treatment for non-melanoma skin cancer. It's a viable alternative to surgery.